Hello everyone. So today we are going to discuss case number 3627 of ophthalmology. A 19-year-old male present with progressive blurring of vision in his both eyes over the past 2 years. He frequently changes his glasses but does not get much improvement. On the slit lamp examination, a brownish ring is noted at the base of cornea and vertical lines are visible on the deep stroma. Keratometry shows increased curvature, and corneal topography reveals an inferior steepening pattern. What is the most likely diagnosis? Alpha keratoconus, beta keratitis Charlie, acute angle glaucoma, or delta corneal dystrophy. I am going to give you 5 seconds so you can answer this question by yourself. Yes, you got it right. The answer is alpha keratoconus. Let's discuss why this is the answer. Our answer is alpha keratoconus. Why this is the answer? Because we see a progressive bilateral vision loss. The patient is changing the glasses but doesn't improve, and we also see brownish ring, that is flasher ring, and vertical line, these are Watt's stria, and increased corneal curvature and inferior steepening on the topography are the classical for keratoconus. What is, by the way, keratoconus? The term is already telling you kerato mean cornea and conus mean the shape is cone-like. I will give you a picture at the end so you can visualize it. Let's discuss why not the other options are correct. Keratitis. Our option was B, keratitis, which is not the correct option. Why? Because it presents with pain, with photophobia, with the redness, not the gradual vision blurring, just like in this case. And in acute, the Charlie option was acute angle glaucoma, which has a sudden vision loss, pain, and halos, not the progressive course, like this case. And delta option was corneal dystrophy, which usually present with painless vision loss and usually symmetric, and no flasher rings or steepening is seen, which is very classical for keratoconus. This is the classical case that I give you for the diagnosis. Let's discuss some other important point regarding these ophthalmological conditions that you will have to remember, and in the future you can correct the MCQs when they are presented to you. If they ask about Monson's sign, this is a V-shape sign. I'm going to show you the picture. When looking the down here, this is classical for keratoconus. You can visualize the keratoconus. Here you can see the Monson signs. It's a V shape. You can see that this pattern. It's the out bulging of the cornea when looking that downward. So this is the keratoconus, and this sign is called as Munson sign. If asked about the painless vision loss with central corneal opacity, this is the corneal dystrophy classically. If asked about honeycomb appearance on the cornea, this is the Fuchs endothelial dystrophy. Okay, Fuchs endothelial dystrophy is classically appeared as honeycomb appearance of the cornea. And another dystrophy is if asked about recurrent corneal erosion plus mapped out fingerprint pattern, this is classical for EBMD. It's another dystrophy. This is called as epithelial basement membrane dystrophy. This is classical for that. Honeycomb is classical for Fuchs endothelial dystrophy, and this is classical for EBMD. And if asked about the ring infiltrate in the contact lens user, this is an condition called as keratitis. Which keratitis? Acanthamoeba amoeba keratitis. Specifically, the case will be a contact lens user that now present with the ring infiltrate. Okay. If asked about dendritic ulcer with decreased corneal sensation, this is classical for herpes simplex keratitis. This is another type of keratitis. Keratitis are different type. So I'm giving you very peculiar knowledge here. So there are much more to be out there in the further videos. So if you want to get that knowledge, please subscribe to our channel and share these videos so it can boost our morale so to make more and more videos and content like that. Thank you so much for your attention.